A young female patient arrives alone in the urgent care, clutching her arm. She is visibly in pain and is very upset. A nurse arrives to take the patient back and realizes that there is a difficult language barrier. She is using hand motions and other means of nonverbal communication while she examines the patient. The nurse realizes that the patient is in pain, but chose not to use assistance from an interpreter to assess her medical history, including drug allergies. She informs the attending physician that the patient is in pain. The physician sends in an order for opiates. The nurse administers the medication and then leaves the room for a few moments. When she returns, she finds that the patient is experiencing severely labored breathing and is clearly having an adverse reaction to the medication. In our practice, our nurses relied on verbal orders from the physician regarding medication prescribing and administration. The nurses admitted that they did not question if the medication or dosage was correct.
Medication reconciliation is a process of creating the most accurate list possible of all medication a patient is taking, including drug name, dosage, frequency, and route, and comparing the list against a physician's admission, transfer, and/or discharge order, with the goal of providing correct medications. Issues with regards to pain communication have been brought to the attention of the Shared Governance Program at our practice. Specifically, communication problems involving patients with limited proficiency in English.
Hi, my name is Jamie. I'm going to be your nurse today. What seems to be the problem here?
I fell, у меня очень болит рука, очень сильно рука болит.
You fell on, it looks like your arm? Is your arm hurting?
Рука.
Okay. When did you fall?
Сегодня.
Okay. Do you mean today maybe, or yesterday?
Сегодня.
Today? Okay. And it's your arm that hurts, so you in a lot of pain?
Очень болит.
It's hurting a lot?
Очень.
Okay. Do you have any allergies to anything that you know of?
Opium.
Okay. Okay, I'm gonna go talk to the doctor really quick. We're gonna see if we can get something to make you more comfortable. I'll be right back, okay?
Please.
The nurse did not take the time to find a way to translate information to and from the patient regarding her medical problem or previous medical history.
Okay, we brought you something for the pain, so just take this. You should feel better, okay? For the pain, yeah, take it. Okay, I'm gonna go talk to the doctor again and we'll see about your arm, and I'll be back in 1 second, okay? I'll be back really quick.
The nurse returns a short while later and finds that the patient is experiencing labored breathing.
Oh my gosh, what happened? Okay, sit up. We're gonna get you some help, okay?
The patient in this scenario did not feel included with decisions being made regarding her care. As a result of the nurse not taking the time to translate information, this led to common medical error which endangered the patient. This does not represent what patient-centered care looks like.
Our nurses had not been provided with the necessary resources required to prevent errors when administering medications. For example, when a nurse was caring for a patient who displayed a limited proficiency in English, the nurse did their best to assess the patient's needs through a very limited source of communication, and ultimately many assumptions were made. Our practice administered a survey to the nursing staff. On average, 17 out of 20 nurses felt uncomfortable with the protocols and procedures when administering medication to patients using verbal orders. Of the 17, only 6 regularly asked for clarification. Of the 20 nurses, only 4 admit to using translator phones when caring for a patient with limited English proficiency. Of the 20 nurses, only 1 was bilingual.
Hi, my name is Julia. I'm your nurse. What brings you in today?
Я упала, I fell, и у меня сильно болит рука.
It's your arm that hurts?
Рука.
Okay, when did you fall?
Сегодня.
Okay, 1 second, okay? I'm gonna have you translate into my phone, okay? I don't understand what you're saying.
Speaking.
What language do you speak?
Русский.
Ruski? Is that Ukrainian? Russian? Russian? Okay. I'm just gonna have you use this app, okay? And I'm gonna ask you questions. What time did you fall?
Сегодня.
Today? You fell today?
Сегодня.
Okay. Are you allergic to anything?
Yeah. Opium.
You're allergic to opiates. Okay. I'll let the doctor know and I'll see if we can get you anything for your pain, okay? I'll be right back.
Thank you.
The nurse was able to communicate and translate information immediately and effectively to the patient without the use of a third party. The patient's care was put back into her own hands. By using advanced technology, the nurse was able to make a connection with the patient, which made the patient feel safe and that she was being understood.
Okay, Dominic, this medication is for your pain in your arm, okay? Hold this, I'm gonna translate for you so you know what's going on, okay?
The use of an advanced technology prevents the possibility of medical errors. The patient was able to communicate her medical history, including allergies, to the nurse immediately. The nurse was able to provide a higher quality of care in being able to relieve her pain and attend her in a shorter duration of time.
A short survey was administered to 40 of our patients ages 20 to 50 years old with a limited proficiency in English. The patients were asked how our practice could increase the quality of care being provided with regards to communication. We gave 3 options to provide translation services, one being the external interpretation telephone service, 2 being a bilingual staff interpreter, and 3 using advanced technologies such as our iMed application. We also asked for a brief explanation of their choice. A staggering 75% chose to implement the iMed application. The patients felt that privacy was a top priority in their direct communication with their medical staff. They disliked having to include a third party in their private medical matters, and explained that the iMed application was something they did feel safe and comfortable using. Our facility is now equipped with an electronic medication reconciliation program. The physician must order medications using this system. The patient's medical history is connected with the new medication ordered. This includes the medication name, time it was given, the route, and dose. The medication reconciliation program will sound an alert if an error has been discovered. Advanced logistics solutions have been implemented in our practice to provide our nurses with the resources that they need to help increase the safety with the administration of medications. iMed is an application created specifically by our practice for our practice. The nurses have been given extensive training to use the application successfully. iMed allows our nurses to have access to medical information in all languages right at the touch of their fingertips. Without the language barrier, the medication error has been reduced. After the 6th month of implementing our new electronic medication reconciliation program with the addition of the iMed application, the nurses in our practice were given the same survey as previously administered. Only 1 out of 20 nurses still found themselves questioning a medication order or while administering a medication to the patient. The nurses do believe that the iMed app has replaced the need of translator services outside of the practice, and it has also provided a direct line of communication between the patient and the nurse, which has increased the overall patient-centered care.